Hi, I'm John Preston Perry, and I'm talking about our video, Performing the Parryscope Technique Gently for Office Tubal Patency Assessment. Now, if I could show you how to gently, accurately, quickly, and safely assess the core determinants of female fertility in a single office visit, most of you would be interested. But that's not how this research started out. In fact, it was rather daunting. We needed $12,000 to $15,000 worth of equipment that only 2% of OBGYNs have, might not work as well in the retroflexed uterus, and we were concerned that proximal patency may not reflect distal patency in hydrosalpinges. So there were some challenges, and in fact, actually, my chair said, "Don't bother, it's a waste of your time, it'll never amount to anything." I've done about 1,000 procedures since then, and it probably took me about 3 to realize we actually were onto something. We had some advantages for the research. We already had the equipment, we knew how to use it. It was known that a small caliber flexible hysteroscopy less than 3 millimeters was particularly gentle for the nulliparous cervix. We didn't have to have FDA approval because it's surgical technique. And frankly, the air bubbles were free, which was the right price. We presented our data in JMIG in May of 2015 for accuracy, and this article in the October edition of Fertility and Sterility shows a lot of the gentleness and patient experience for it. For accuracy, again, 98 to 100% sensitivity for tubal occlusion, just under 84% specificity. For gentleness, it was night and day difference for HSG. The risk ratio was 110 with a p-value of 1 in 100 trillion over a large sample size. And so it was very clear patients preferred this. Now, I know I'm not going to convince the Michelangelos of HSG to paint with a different brush. I think the most important thing for patients is getting a good set of eyes and hands for whatever technique is used. However, I think as someone who performed sinus-salpingography and HSG for years, this approach has so many advantages that it's worth switching to, at least for me, and I think a lot of other physicians will. It's just a matter of people trying it in time, and frankly, the patients overwhelmingly prefer it. The things that I think are not inherently obvious from the video that everyone should consider. First is that you aren't going to get the same experience if you use rigid hysteroscopes or large caliber instruments. And I'm not just talking 6 millimeters or even disposable 4 millimeters. Even with 3.5 and 3.1 millimeters, we saw more cervical abrasion in the nulliparous cervix that was associated with discomfort, as well as also increasing tubal spasm. So I think there are going to be a lot of people who try this using the wrong equipment, and they're not going to get the same experience. The other thing is to think about it not just as a hysteroscopic technique, but for the advantages when combined with ultrasound. And for semantics, we distinguish the Parryscope technique, which is focused solely on air-infused saline and flexible office hysteroscopy, relative to a larger Parryscope approach, which is combining things with ultrasound. And so you're using antral follicle count for ovarian reserve, you're looking at ultrasound and hysteroscopy for uterine factor, and then you're using the sonographic sliding sign as well as the air-infused saline hysteroscopy for tubal patency. So I think that resonates with a lot of patients, being able to have a single visit where you do all the core determinants of female fertility in an accurate, gentle, safe, and quick fashion. Now, what pushes us and drives and motivates us for so much of this is we want to do right by our patients. And I think it's not just a matter of giving accurate results in a single visit, but ultimately so many patients are afraid of pain. And I think we showed actually that the patients who'd had previous HSGs doubled their time before seeing a specialist because they were so worried about being hurt again. I think our field can be more gentle, be more accurate, and ultimately do right by those entrusted to our care. And I hope this will help you do the same. Thank you for listening.